Hello everyone. Today's interesting topic is on the blood vessel or a vascular tissue. So the layer of a blood vessel, before going to the layer, there are three types of blood vessel: artery, vein and lymphatics. Artery is a blood vessel which carries the blood away from the heart. Example: aorta, pulmonary trunk, brachial artery of the arm, radial and ulnar artery of the forearm, palmar arteries, superficial and deep palmar arteries of the palm, digital arteries of the digit. These are the examples of arteries. What is a vein? A vein is a blood vessel which carries the blood towards the heart. So examples of the vein: superior vena cava, inferior vena cava, cephalic vein, basilic vein, long saphenous, short saphenous, median cubital vein. What is a lymphatic? Lymphatic is a blood vessel which carries the lymph or the plasma or the interstitial fluid. Example: thoracic duct. Coming to the histology of the vascular tissue, or what exactly is a vascular tissue made up of. The vascular tissue, whether it is an artery, vein or a lymphatic, it's made up of three layers, three coatings. From inside to outside they are tunica interna, that is the innermost covering, tunica media, that is the middle covering, and tunica externa, that is the outermost covering. So tunica means, tunic means covering, that is the overall understanding. Tunica interna means it's closer to the lumen. What is a lumen? Lumen is a place where the blood can travel, so that is called as lumen. So tunica intima is closer to the lumen, therefore the name. Media is a covering which is in the middle. Media means middle. Tunica externa is the outermost external covering of the blood vessel. Tunica intima is made up of three layers. They are endothelium, that is a simple squamous epithelium and its basement membrane, of course, and subendothelial connective tissue, that is a connective tissue which glues the endothelium to the underlying tissue, is called as subendothelial connective tissue. Then a wavy layer called as internal elastic lamina, which allows the blood vessel to expand without breaking, that is called internal elastic lamina. So tunica intima is made up of, intima or interna is made up of endothelial, that is a simple squamous epithelium, subendothelial connective tissue, which is a glue which connects the endothelium to the underlying components, and internal elastic lamina, which is a wavy layer of elastic fiber which allows the blood vessel to expand when more amount of blood travels through the blood vessel without causing the blood vessel to rupture. Now coming to the tunica media. The tunica media is made up of two main components. One is the smooth muscle and the other one is the elastic fibers. Smooth muscle, the contraction of the smooth muscle reduces the lumen of the blood vessel, thereby increasing the resistance and the blood pressure. Elastic fibers, the elasticity of the elastic fibers make the blood vessel pliable like a dough, so it can expand and accommodate extra amount of blood if required. When you're running, more blood flows to your lower limb. When you're fighting with your arm, more blood flows to your upper limb thanks to the elastic fibers present in the tunica media. Media means middle layer, consists of smooth muscle and elastic fiber. Also one small component is there called external elastic lamina, which is a wavy layer present on the external aspect of the tunica media. Last but not the least, tunica externa, outermost connective tissue covering. It's mainly made up of collagen fiber, also few elastic fiber. The outermost covering of the blood vessel is called tunica externa, also called as tunica adventitia, additional layer of connective tissue. Adventitia, that's the other name for that. So this is, in addition to this, the externa consists of, one second, yeah, can you see these tiny blood vessels on the surface of the larger blood vessel, the tunica externa there? These tiny blood vessels are called Vasovasorum. They begin from the lumen and then come on the external aspect to supply the outer portion of the blood vessel. They're called Vasovasorum. Vaso means blood vessel. Vaso means another blood vessel. So tiny blood vessels are supplying the wall of the larger blood vessel is called Vasovasorum. So similarly there will be vasonervosum. that is autonomic nerve supplying the outer portion of the blood vessel and allowing the functioning of the blood vessel according to the requirements. So what is that requirement? When parasympathetic nervous system will activate, the blood vessel will dilate. When sympathetic nervous system will activate, the blood vessel will constrict. That is caused about by autonomic nerves called as vasonervosum. So to summarize, the blood vessel, it can be an artery, vein or lymphatic. The components remain the same. The tunica intima is made up of endothelium, subendothelial connective tissue. Endothelium is simple squamous epithelium, subendothelial connective tissue is a loose connective tissue, internal elastic fiber or lamina is made up of elastic fibers. Tunica media, which is mineral coating, it's mainly made up of smooth muscle and rich amount of elastic fibers. Smooth muscle helps in resistance, elastic fiber gives a pliability to the blood vessel. Tunica externa or the tunica adventitia mainly consists of outermost covering of connective tissue covering of a blood vessel. It consists of Vasovasorum, tiny blood vessel supplying the outer portion of blood vessel, and Vasonervosum, that is blood nerves, autonomic nerves supplying the smooth muscles and the connective tissue in the blood vessel, Vasonervosum. Thank you for your patience. Thank you for your learning from Logic Medico.